Today we are going to discuss the Menkes disease. So to start off with questions, the first question is, let me know the features of clinical features. What are the clinical features of the Menkes disease? The second question is, you need to tell me what are the lab findings of the Menkes disease. Lastly, what is the treatment of the Menkes disease? And at the end of the video, we'll ask some bonus questions as well. So to start off with, what is a Menkes disease? So there is decrease in copper, and there is a defective there is a defective lysyl oxidase. So there's defective lysyl oxidase. This is due to decrease in the copper, due to the decrease in the copper. And there is significant, that is depigmentation. So this is a very characteristic finding. This depigmentation, that is kinky hair, is present. Other thing to know is the ATP7A is involved more, and here what we see is the males are more prone than the females. These are some very important points to be known about the Menkes disease. So now we will go about the clinical features. So what are the clinical features of the Menkes disease? So first of all, the clinical features we discussed about the hair. So the hair is there's sparse as well as kinky. Then we move on to the developmental milestones. So the developmental, let me write it down. It's not diabetes, it is developmental milestone. So developmental milestone is there is a loss, that is it is decreased, and looking at the truncal hypotonia. So there is truncal hypotonia is present. Then we move on to the other feature, that is there is also failure. There is failure to thrive, as well as there is epilepsy. Now we move on to the lab. So what are the lab findings? There is a decrease in the serum copper, as well as there is a decrease in the serum ceruloplasmin. So next the question arises, what is the treatment? So treatment is by the copper chloride as well as the L-histidine injections. Now we are going to answer our questions. So the first question we asked was, what is the clinical feature? This was the first question we asked. So the clinical features of Menkes disease, we are going to talk about the hair. So it is sparse and it is kinky. Then we spoke about the developmental milestones. It is decreased. Then there is also the truncal hypotonia. Next, as we move on, there is also the failure to thrive. And there is also epilepsy. Next, we move on to the labs. So what are the lab findings? This was the second question we asked. What are the lab findings? There is decrease in the serum copper, as well as decrease in the serum ceruloplasmin. Then we move on to the treatment. So what is the treatment of the Menkes disease? So this was the question we asked. So the treatment is nothing but there is a copper chloride. So there is copper chloride and the L-histidine injections. So these were the answers to our questions. So now we have some bonus questions. So you can answer these bonus questions in the comments. So the first question is, who are mostly affected? Is it the males or the females which are most commonly affected by the Menkes disease? Then next one is, what enzyme is defective in the Menkes disease? Third question is, what is the gene which is responsible for the Menkes disease? Which mutation is responsible for the Menkes disease? So these answers you can give it in the comments.